Hello all and welcome to this channel. Today in this video we are going to talk about what are triglycerides and how to lower triglyceride levels. In fact, triglycerides are a type of fat found in our blood. After eating, our body converts the unburned calories into triglycerides and stores them in our fat cells to be used for energy later. If this storage goes beyond the normal levels, then one should be careful of it. Now let's see triglyceride levels with categories. While triglycerides are an important energy supply for our body, having too many triglycerides in our blood can increase our risk of heart disease. Here are some guidelines regarding triglyceride levels for adults in milligrams per deciliter. For normal category, the optimum level of triglyceride is less than 150 mg per deciliter. For borderline high, the level of triglyceride should be between 150 to 199 mg per deciliter. For high category, it should be between 200 and 499 mg per deciliter. In the last, for very high category, it should be up to 500 mg per deciliter or above. You can manage this by keeping all these values in mind. Here are some tips to lower our triglyceride levels through a variety of dietary and lifestyle changes. The tip number 1 is set a target for a healthy weight. Whenever you eat more calories than the body requirement, your body turns those calories into triglycerides and stores them in fat cells. For having a moderate body weight, consuming fewer excess calories can be an effective way to lower your blood triglyceride levels. In fact, losing 5 to 10% of your body weight can significantly reduce the triglyceride levels. The tip number 2 is limit your sugar intake. Actually, added sugar is a big part of many people's diets. While the American Heart Association recommends that consuming no more than 100 to 150 calories of added sugar per day. Added sugar is commonly found in sweets, soft drinks, and fruit juices. Extra sugar in your diet may be turned into triglycerides, which can lead to an increase in blood triglyceride levels along with other heart disease risk factors. Another study found that consuming high amounts of added sugar is also associated with higher blood triglyceride levels in children. Fortunately, low-carb diets can lead to a decrease in blood triglyceride levels. Even a simple change such as replacing sugar-sweetened beverages with water could decrease triglycerides in some people. The tip number 3 is follow a lower carbohydrate diet. Much like added sugar, extra calories from carbohydrates in your diet are converted into triglycerides and stored in fat cells. Not surprisingly, low carbohydrate diets have been linked to a lower blood triglyceride levels. Starting low carbohydrate diet within 6 months, you will see a greater decrease in triglyceride levels. The tip number 4 is eat more fiber. Dietary fiber is found naturally in fruits, vegetables, and whole grains. It is also found in many other plant sources including nuts, seeds, cereals, and legumes. Adding more fiber in your diet can slow the absorption of fat and sugar in your small intestine, helping decrease your triglyceride levels. According to a research with overweight or obese adults, it was found that eating more dietary fiber was linked to lower triglyceride levels. Furthermore, consuming a high-fiber cereal alongside in a breakfast high in fat can reduce post-meal triglyceride by 50%. The tip number 5 is exercise regularly. Aerobic exercise in addition with weight loss is especially effective at decreasing triglycerides. The American Heart Association recommends getting at least 30 minutes of aerobic exercise 5 days a week, which can include activities like walking, jogging, bicycling, and swimming. The benefits of exercise on triglycerides are most apparent in long-term exercise regimens. People with heart disease who do exercise for 45 minutes 5 times a week lead to a significant decline in blood triglycerides. All exercises help reduce triglyceride levels. However, some research has found that exercising at a higher intensity for a shorter amount of time is more effective than exercising at a moderate intensity for longer periods. The tip number 6 is avoid trans fats. Artificial trans fats are a type of fat added to processed foods to increase their shelf life. Trans fats are commonly found in commercially fried foods and baked goods made with partially hydrogenated oils. They can also be found in small amounts in some animal products. In recent years, the addition of trans fats to food has been banned in the United States. Due to their inflammatory properties, trans fats have been attributed to many health problems, including increased LDL, bad cholesterol levels, and heart disease. However, replacing trans fats with polyunsaturated fats in the diet can help reduce triglyceride levels. The tip number 7 is eat fatty fish twice a week. Fatty fish is well known for its benefits on heart health and ability to lower blood triglycerides. This is mostly due to its content of omega-3 fatty acids, a type of polyunsaturated fatty acid that is considered essential. It means you need to get it through your diet. It is recommended to eat 2 servings of fatty fish per week to reduce the risk of heart disease and stroke. Interestingly, eating salmon twice a week can significantly decrease blood triglyceride concentrations. Salmon, herring, sardines, tuna, and mackerel are a few types of fish that are especially high in omega-3 fatty acids. The tip number 8 is eat more unsaturated fats. Monounsaturated and polyunsaturated fats can reduce blood triglyceride levels, especially when they are replacing carbohydrates in your diet. Monounsaturated fats are found in foods like olive oil, nuts, and avocados. Polyunsaturated fats are present in vegetable oils and fatty fish, as well as nuts and seeds such as walnuts, flax seeds, and chia seeds. Olive oil consumption decreases triglycerides levels so significantly than other types of plant oil. Saturated fat intake is associated with increased blood triglycerides, while polyunsaturated fat intake is associated with lower triglyceride levels. To maximize the triglyceride lowering benefits of unsaturated fats, pick a heart-healthy fat like olive oil and use it to replace other types of fat in your diet, such as trans fats or highly processed vegetable oils. The tip number 9 is establish a regular meal pattern. Insulin resistance is another factor that can contribute to high blood triglycerides. After you eat a meal, the cells in your pancreas send a signal to release insulin into the bloodstream. Insulin is then responsible for transporting sugar to your cells to be used for energy. If you have too much insulin in your blood, your body can become resistant to it, making it difficult for your body to use insulin effectively. This can lead to a buildup of both sugar and triglycerides in the blood. Fortunately, setting a regular eating pattern can help prevent insulin resistance and high triglycerides. For instance, research shows that not eating breakfast can lead to decreased insulin sensitivity. The American Heart Association suggests that irregular eating patterns seemed less likely to achieve healthy cardiometabolic levels. Regardless of how many meals you are eating daily, eating regular meals can improve insulin sensitivity and lower blood triglyceride levels. The tip number 10 is limit alcohol intake. Alcoholic beverages are often high in sugar, carbohydrates, and calories. If these calories remain unused, they can be converted into triglycerides and stored in fat cells. Additionally, alcohol can increase the synthesis of large, very low density lipoproteins in the liver, which carry triglycerides into your system. Moderate alcohol consumption can increase blood triglycerides by up to 53%, even if your triglyceride levels are normal. Our research has linked moderate alcohol consumption to a reduced risk of heart disease, while linked binge drinking to an increased risk. The tip number 11 is add soy protein to your diet. Soy is rich in isoflavones, which are a type of plant compound with numerous health benefits. While widely known for its role in lowering LDL bad cholesterol, soy protein has been shown to reduce blood triglyceride levels. Regular consumption of soy protein is linked with significantly lower triglyceride levels in postmenopausal women. Soy protein can be found in foods like soybeans, tofu, and soy milk. The tip number 12 is eat more tree nuts. Tree nuts provide a concentrated dose of fiber, omega-3 fatty acids, and unsaturated fats, all of which work together to lower blood triglycerides. One analysis shows that each daily serving of tree nuts decreases triglycerides by an average of 2.2 mg per deciliter. And these tree nuts include almonds, pecans, walnuts, cashews, pistachios, Brazil nuts, and macadamia nuts. However, keep in mind that nuts are high in calories. A single serving of almonds, or about 23 almonds, contains 164 calories. So, moderation is the key. People who consume 3 to 7 servings of nuts per week enjoy greatest health benefits. So this is the end of the video. If you like the video, don't forget to like and subscribe this channel.